Hi, everyone. I'm super excited to be here today to talk about the gut x-axis. This is truly an emerging framework that highlights that constant communication that exists between the gut microbiome and the rest of the body. My name is Kara Siedman. I'm the director of partnerships here at Resbiotic. I'm a registered dietitian, and I've worked in gastroenterology care, for the last 15 years in various microbiome companies. And it's been exciting to see this framework because we so often think of health in these isolated systems, cardiovascular, respiratory, neurological, but we know through research that we're revealing just how interconnected these systems are. And that's really through the lens of the microbiome. And each organ, each system of the body has its own microbial community. And we know that they're not working in silos. And so that's truly the foundation of Resbiotic. Res standing for restoration. Our mission truly is to restore health for those that are dealing with chronic conditions. And really also to get to that foundation by targeting proactive wellness through the gut microbiome, the microbiome being this central hub of systemic health. So, with that, let's talk a little bit about the gut microbiome, right? We know that humans and microbes have evolved in symbiosis, that we provide food, we provide shelter, right? We're not what we eat, but who we feed or what we feed. They provide vital health benefits. 70% of the body's bacteria resides in the colon, so the gut microbiome being the largest microbiome. And the gut microbiome has 150 times more unique genes than our own genome. So, truly making us what we call a holobiont or a human micro superorganism. And what we often think, or what we think about gut health, is that we see these obvious poor microbiome symptoms. We think it means that it's abdominal pain or bloating, bowel changes, gas, food sensitivities, and intolerances. And in fact, these may be often the first signs or symptoms that arise when there's a problem or a disruption that's occurring in the microbiome. But we know, and the reality is that microbial imbalance doesn't stay in the gut, right? We know the gut influences every aspect on human health. We can essentially link back almost every chronic condition back to the gut microbiome or the health of the gut microbiome. And it can show up as symptoms and in conditions affecting everything from our hormonal health to bone and joint health, brain health, metabolic health, lung health, and beyond. And so being that microbial imbalance doesn't just stay in the gut, it's rewiring our body's inflammatory, metabolic, and immune networks that impact beyond the gut itself. And so this is what we call the gut x-axis. This is a term that we've coined at Resbiotic to explain how our gut communicates with other bodily organs, how to modulate biological pathways, and really how we can then deliver these precise health benefits. And this is mediated through systemic circulation, which is basically that super highway that carries oxygen and nutrients, hormones, immune cells, signaling molecules like short chain fatty acids that allow these systems and organs to talk to one another, to talk to each other, creating these bi-directional relationships. And I always like to talk about this because one of the biggest questions and areas of research is truly focused on, answering this question of what does it mean or what does it look like to when we think about a healthy gut microbiome. And we don't really have a true pattern or signature or profile of a healthy gut microbiome. We have key characteristics that we know are necessary to promote resiliency. And so when you have eubiosis, where there's an abundance of beneficial microbiota, we have low levels of pathogens. This reinforces that healthy mucosal layer, that security perimeter, that barrier that protects the microbiome and protects your immune from the immune system and vice versa. So we see well-formed tight junctions. Those individual fence posts are tightly knit together. And so essentially a healthy microbiome really truly acts as a peacekeeper for our immune system and for our overall health. But microbiome disturbances, microbiome external pressures, what we call the exposome, these external factors that are around us, that are here in our daily lives, in the world that we live within, that can disrupt this balance. And so these microbial or microbiome disturbances that can occur from early life throughout our life begin to weaken and threaten the immune system's tolerance and essentially contribute to dysregulated gut microbiome signals and essentially leave the body more susceptible to long-term health challenges and even predisposing conditions like allergies and obesity throughout life. And this is important because when we think about these external factors like stress, our diet, of course, being probably one of the biggest modifiers, medications like antibiotics, proton pump inhibitors, we are essentially, living in a world where, our bodies are incompatible with the world that we've created. And we've created a world that's, fundamentally not built for our body. And these microbial disturbances, these external factors, the exposome, can essentially lead to a dysfunctional gut microbiome. What does that look like? What changes are happening? That's characterized by having microbial dysbiosis. So, an imbalance where we have higher levels or a higher abundance of pathogens. This ultimately creates an environment that's more friendly for pathogenic and opportunistic bacteria to replicate, to multiplicate. And this really is what begins to drive that breakdown in your mucosal barrier. So my fence is not as secure. Those individual fence posts, we start to lose the formation of those tight junctions. Um, and this essentially leads to a barrier defect and allows for different bacterial constituents and components like lipopolysaccharides, which are endotoxins that are released from the outer membrane of our gram-negative bacteria, especially our proteobacteria, that when these bacteria die, which happens, of course, with consuming food and eating, they can release LPS into the gut. And so having higher levels of proteobacteria, having higher amounts of LPSs, this is very common in a lot of the conditions we see from asthma to obesity, can lead to that greater endotoxin release. And so in that image that we saw of a healthy gut microbiome, LPS is essentially kept in check. It's circulates at normal levels. But when the gut barrier is compromised, when we lose formation of those tight junctions, when we have barrier defect, then those LPSs can translocate, get into systemic circulation, and can really start to drive immune activation and inflammation to take place. And so a dysbiotic or an imbalanced gut microbiome is miseducating the immune system and these other organ systems, leading to dysregulation and inflammation throughout the body. And so we're going to explore some of these various axes in a little bit more depth to talk about how that gut specific immune connection is taking place. And so let's talk about the gut lung axis. We often focus on so much of what we're eating, which is truly important. It's the biggest modulator of a healthy gut microbiome. But what we breathe also matters just as much. And we take more than 20,000 breaths per day. The lungs are in constant contact with our external environment. And we used to think, really 10, 15 years ago, we used to think the lungs were this sterile environment, but they in fact house their own unique microbiome. It's much less and smaller than the gut microbiome, but very similar. And so the gut and the lungs are deeply connected through different immune and microbial signaling. And when the gut-lung axis is disrupted, this can truly start to fuel chronic respiratory issues, decreasing respiratory resilience. And so we focus on building resilience to the gut, but we also have to be concerned with lung resiliency. And really because when we look at kind of the state of where we are, we know that more than 130 million Americans are living in areas of unhealthy levels of air pollution. And so we have these real world problems. In fact, there has been studies that have come out recently looking at the impact of air pollutants, not just on the lung, but truly on the gut microbiome and how that creates imbalance along these axes. We know that COPD is actually the third leading cause of death worldwide, and we don't have the same sort of drug development that occurs in other conditions, say like cardiology, in the respiratory space. The use of e-cigs and vapes, these continue to be on the rise. They continue to increase, especially among younger adults, and their damage to them, damage to the lungs isn't problematic, but it's also lifelong. And so what is this gut-lung axis? So the gut and lungs are obviously deeply connected. It's through a shared immune and circulatory network. This is especially via the thoracic duct, which delivers gut-derived lymph cells, immune cells, and microbial metabolites like your short-chain fatty acids straight to the lungs, or microbial metabolites like lipopolysaccharides, which we know are highly inflammatory and immunogenic, to the lungs. And so they travel via our bloodstream and our lymphatic system. And that's what can start to modulate those lung immune responses, can start to drive inflammation, and even impact mucosal repair. And so your gut microbiome can truly shape lung health, can even impact and shape lung resiliency to respiratory disease. So think about two people living in the same household. One person gets pneumonia, is perfectly fine, fights it off. The other person ends up in the hospital. It comes back and comes down to, well, how resilient is your microbiome and that crosstalk that's existing between the two. When we look at dysbiosis and how a dysfunctional gut microbiome is truly that igniter or what fuels inflammation to the lungs. And so we start to see in specific conditions, conditions like acute respiratory distress syndrome, sepsis, right? That's characterized by having significantly very high levels of lipopolysaccharides that can appear in the lungs. And this correlates very strongly with inflammatory markers like TNF alpha. And so this really starts to showcase that microbial translocation from the gut playing a significant role in respiratory immune activation, systemic inflammation. Conditions like COPD, we see intestinal barrier damage. There's increased permeability. There's reduced levels of those beneficial bacteria, so reduced levels of short-chain fatty acids. There's been studies done that look at fecal transplants from COPD patients that have been shown to actually induce emphysema and lung inflammation in animal models, which is really exciting to see that modulation that takes place. But we also see that similar crosstalk in asthma, in IBD, where inflammatory gut conditions can often precede or co-occur with airway disease. And especially when we talk about COVID-19, many of us, in fact, working with long COVID patients, we know COVID-19 isn't just a respiratory virus. It actually attacks the microbiome. It leads to microbial imbalance, increased GI and systemic inflammation. And in fact, there have been studies shown that worse COVID-19 infections, that there was actually correlated with more microbiome dysfunction. And so long COVID are actually being seen as a microbiome condition. In fact, there was actually a recent study that came out looking at that those that had worse dysbiosis, it correlated with worse COVID outcomes. So the gut-lung axis is a newer axis that's being looked at in how not just having respiratory conditions can drive or be associated with gut dysfunction, but if we have gut dysfunction, how that's decreasing resiliency to the lungs. So we're going to shift from lungs to our metabolism, another axis that's getting a lot of research and focus when we start to think about metabolic health and the state of metabolic health that we have. So like the gut-lung axis, there's this constant crosstalk and communication between the microbiome, our immune system, and these various metabolic pathways. We see clear microbial imbalances in conditions like obesity, people who have type 2 diabetes, and metabolic syndrome. And so I think about a lot of the patients that I've worked with that are really doing everything really well, that are eating well, they're exercising, they're changing their lifestyle, but are still struggling. And that issue may actually lie not in their metabolic health, but in their gut health. And so it's beyond calories, it's beyond our genes, the microbiome truly being that gateway to help build that metabolic resilience. And so one of the biggest areas of focus, especially when we think about health span longevity, is the rise and continued rise in metabolic issues. And ultimately, everyone needs to be concerned about their metabolic health. We know 1 in 3 American adults has metabolic syndrome, 1 in 6 have diabetes. 88% of Americans are considered metabolically unhealthy, which is such an alarming number. So much of our healthcare spending is being spent on metabolic conditions. As we move through certain life cycles and stages like menopause, our metabolic risks increase. And we know from so much of the research that obesity is a major risk factor for so many other chronic health conditions. And so, what are the mechanisms when we talk about this gut metabolic axis? I was recently listening to a talk and a speaker, said, my microbiome made me eat it. I kind of take that to a whole nother level of saying, my microbiome made me do it. But there's a lot of truth behind that. And so 90% of our gut bacteria, especially for those of us that are familiar with stool testing, reside within sort of 2 key phyla. We have our Firmicutes and we have our Bacteroides. And so in obesity, we often see a higher firmicutes or firmicutes to Bacteroides ratio. And that actually translates to a microbiome that's actually more efficient at extracting calories from the same foods, which is why you can have someone who has obesity or suffers from obesity, and you take a lean person, they consume the same food. That obese microbiome is metabolically thrifty, is more efficient at extracting those calories, but that does come, that efficiency comes at a cost. So we see in the obese microbiome or in the metabolic disrupted microbiome, we see altered fatty acid and bile acid metabolism, which is also associated with increased gut permeability. We see a greater endotoxin, so greater LPS translocation, which is a driver of low-grade chronic inflammation. There's been many studies done looking at how that LPS translocation and translocation from the microbiome actually preceding changes in insulin and changes to weight. Disruption in key metabolic signals like short chain fatty acid signaling, which is so important when it comes to glucose regulation, lipids, satiety hormones like GLP-1. So in a dysbiotic microbiome, we see impaired hormone signaling, so reduced GLP-1 production, more leptin resistance, altered ghrelin, so all of this disrupting those hunger cues. So again, when we hear that patients or we see patients doing a lot of things right and they're still struggling with metabolic dysfunction, we have to consider the condition of the microbiome. And so, of course, we can't talk about metabolic health without talking about the rise and the use of medications like our GLP-1 receptor agonists. Um, and we know that, as most people and as providers, we have to talk about indications related to this, but GLP-1 is in fact produced by our GI tract. A lot of people don't realize that. We just think of it in terms of the GLP-1 agonists. It's produced by our intestinal L cells, but the release of GLP-1 from those intestinal L cells is heavily influenced by microbial signals. And so it opens up a very important clinical opportunity that modulating the microbiome through diet, through microbiome specific supplements, that we can actually enhance not just our endogenous metabolic pathways, but even medication response. There's been a lot of research being focused on GLP-1 agonists. And in fact, there's been research that's looked at response rates in GLP-1 agonists, and that they found that responders to GLP-1 therapy had higher levels of certain microbes, determining that, our microbiome composition can actually impact drug efficacy. There's been studies done that have shown that even in bariatric surgery, that if you can modulate and support the health of the microbiome, that we see more long-term sustainable results. Okay, so we're going to take it one step further. So thinking about kind of this gut digestion, metabolic brain axis, what I like to think of as the gut energy axis. So the communication that exists between what our microbiome produces or doesn't to how our metabolic pathways respond and the impact and effect that that has on brain health and brain signaling. And this is why even in conditions like obesity, we see increased risk of developing neuroinflammatory conditions like Alzheimer's, increased cognitive decline. And really at the root of this are our short chain fatty acids, especially butyrate, that come into play. And so when we look at metabolism, energy, brain health, it all points back to the microbiome at the root. Despite this, we know that Americans aren't supporting their gut health in meaningful ways. We know that so many people are suffering from digestive distress and digestive symptoms. But I think even more alarming is that majority of Americans, in fact, 7%, probably even less than that at this point, are eating the recommended amounts of fiber. And so fiber being really one of the key components to what supports a healthy microbiome, it's really the most essential fuel for a healthy gut microbiome. So with only 7% of Americans meeting that recommended fiber intake, let's talk about fiber and more specifically prebiotic fiber. And so we often use the term fiber very broadly, but not all fibers are considered prebiotic. So prebiotics, often thought of as the fuel or the fertilizer for growth. It's what feeds our probiotics. I like to call these, and we see this in some of the microbiome research, as our microbiota accessible carbohydrates, or MACs, because these are specific fermentable fibers that feed and nourish the growth of our beneficial gut microbes. So your prebiotics are the food for your probiotics. They're not living, they're not live bugs. And they're most abundant in things like your inulin, your galacto-oligosaccharides, those resistant starches. So if you think of those FODMAP containing foods, and then our beneficial microbes, our probiotics that live within, convert these into short chain fatty acids, your propionate, acetate, and butyrate. And these metabolites specifically impact everything from immunity to inflammation to metabolism to gut integrity, even brain function. So the big difference is that these prebiotics have to be fermentable by the microbiota and utilized by the microbes. That's truly what separates them from your other fibers. And so your short chain fatty acids, right? These are your key signaling molecules that are produced when our gut microbes ferment these microbiota accessible carbohydrates or MACs or prebiotics. And so again, your main short chain fatty acids are your acetate, propionate, and butyrate, and they do act as powerful mediators of the gut, our immune system, our brain, and metabolic health. So our short chain fatty acids have far-reaching benefits. They strengthen the gut barrier, so they're important to promote tight junction formulation. They regulate inflammation by activating our regulatory T cells through the production of interleukin 10, our anti-inflammatory cytokine. This can even cross the blood-brain barrier, reducing neuroinflammation. We know that our short-chain fatty acids, especially butyrate, help to strengthen the blood-brain barrier. Metabolically, our short-chain fatty acids stimulate GLP-1. So butyrate binds to, you can see over here, binds to those G protein coupled receptors. And this promotes the production of GLP-1, peptide YY, which is important for insulin sensitivity, our appetite regulation, energy regulation. And so without sufficient fiber, and specifically without sufficient prebiotic fiber, our gut bacteria lose their primary energy source and they really begin to shift metabolism from carbohydrate fermentation, so from fiber fermentation, to proteolytic or protein fermentation, which in a dysbiotic microbiome can actually generate more harmful metabolites, especially if we have more opportunistic, more pathogenic bacteria. And so when we think about gut health and the support around gut health and all these various communication networks, we just touched on a few, but there's very many different axes that exist, including the ones we talked about, truly rooted back in the health of the microbiome and the role of the microbiome as really a master conductor of health. And when we think about fixing the gut and a lot of the common approaches that we use to support gut health can in fact actually fuel dysbiosis. And so one of the big things we see, especially in my world as a dietitian, and I've definitely been guilty of this early on in my career, was doing long-term restrictive diets or even people coming to me on restrictive diets following, low FODMAP diet for, more than 3 months. In fact, I've had patients that have been on low FODMAP diet for 10 years, 5 years. There's been studies looking at long-term restrictive diets, especially the FODMAP diet, and how it starves the microbiome of these MACs, these microbiota accessible carbohydrates, your prebiotics that your probiotics need to thrive. So we need to be very cautious and really need to be supportive to move beyond that. Your restrictive diets, your dietary eliminations are very necessary sometimes to manage symptoms, but what is it doing in the long term? Overly aggressive antimicrobial and antibiotic protocols we know are not just impacting your harmful bacteria, but they also can impact your beneficial bacteria. And so as much as they're necessary sometimes, they reduce symptoms in the short term, but potentially can leave the ecosystem and the terrain depleted and less resilient over time. And so, of course, there's a time and place, for these tools, but without personalization or a clear understanding of microbial functions, clinical validation for these microbiome interventions that we use, we potentially risk doing more harm. So true gut health support, it's not a one-size-fits-all model. It does require precision, very targeted interventions, evidence-based formulations that truly support the ecosystem and can drive these meaningful changes to these targeted axes. And so that's exactly what we're focused on at Resbiotic is targeting these, microbiome solutions for gut axis balance, meaning to target solutions to these various systems of the body. We focus on using a variety of microbiome modulation from prebiotics, the food for your probiotics, to probiotics, which are the live microorganisms that when consumed in adequate amounts confer health benefits, to postbiotics, which I love talking about postbiotics. We're going to start to see a lot more of these. These are non-viable microbes and or also their cell components, with or without metabolites. We used to think of just postbiotics as being butyrate, but these are actually purposefully inactivated microbes we found through this advanced research and the ability to study our microbes more intimately, that as these probiotics die or become inactivated, they can retain some targeted function. And so we know that bacteria, viable, generally refers to the ability of these cells to grow and reproduce under these favorable conditions. We know that bacteria can enter what's called a viable but non-culturable state, where they're alive, but they cannot be readily grown in culture, yet they still retain the potential to potentially be culturable again. So getting a little too in depth, but your postbiotics, so in every probiotic, there are postbiotics present, but postbiotics are specifically these targeted benefits. And so oftentimes we'll hear the term ghost biotic. So they're a really exciting area of microbiome solutions that are very stable. They're not affected by heat. They're not affected by stomach acid. So it's an exciting area. When it comes to your probiotics and your postbiotics, the efficacy of, meaning what they're doing, the function of these probiotics and postbiotics are strain dependent. So your strain determines function. So what's a strain? So I like to think of often of dogs, right? You can say, okay, all dogs are considered dogs, but a West Highland Terrier looks different, functions different, acts different than a Yorkshire Terrier. That's the strain. So when it comes to probiotic, postbiotic, they all will have and should have a unique name that includes the genus. So this is an example here of Lactoplanctobacillus, plus the species, so Lactoplanctobacillus plantarum. And then you'll have the strain, which is often those letters and numbers that follow, Lactoplanctobacillus plantarum RSB11. And this is really important because when it comes to the efficacy of products from supplements in the probiotic and postbiotic state world, you cannot extrapolate research on, say, Lactoplanctobacillus RSB11 on a different Lactoplanctobacillus plantarum strain. And we'll see that. So we'll see products that list out Lactobacillus acidophilus, but they're not specifying that strain. And so when companies do that, it's often because they're changing out via what's available from an ingredient standpoint, the strain that they're using. And you cannot extrapolate the research that's been done on one strain to another strain. And so this is important as we start to get more advanced in the microbiome world. And that's part of the reason why at Resbiotic, when we're working on formulation, we're using advanced genomic sequencing, we're using deep science, R&D development from in vitro, in vivo, ex vivo assays, human clinical studies to truly understand this idea of strain specificity and more so how to target the functions of these products. We're a company that's founded by physicians, scientists, and we're really built from the ground up using that same level of pharmaceutical rigor and development from strain selection to clinical validation. So, for example, of what we're doing is we use different lab testing, different in vitro assays to study how our strains and their metabolites are interacting with these specific organ systems. So this is different organoid models that we'll use. And this is truly what helps us design targeted products to support the right system and to isolate function to system. So for example, one of the assays that we do, we test something called MMP9. This is an enzyme that increases with inflammation and tissue damage. It's expressed in various tissues of the body. So an elevated MMP9 is linked to conditions like IBD and asthma, neuroinflammation, cognitive decline. So when we use this as a marker, we can look at different MMP9 levels, say in the gut, oops, let me go back, in the lung, in the ovary, in the bone, and the liver to determine if we're getting targeted function. So studying how our strains impact this biomarker, we can design precision formulations really to deliver those targeted organ-specific results. And so when I talk about innovation, precision, that's really the rigor that goes behind every single product that we're developing, from strain selection to preclinical R&D development to following everything up with human RCTs. We are truly working to change the narrative of what quality supplements and what microbiome supplements should look like, and really helping to understand the efficacy behind that. So, one of our first products was really developed out of our founder, Dr. Vivek Lal, who is a neonatologist, got into early lung microbiome research. Again, we used to think the lungs were this sterile environment. And he was focused on microbiome solutions. And that's really what kind of really was the start of our lung support probiotic. These are three respiratory specific strains developed and harvested from healthy human microbiomes, studying their direct impact on respiratory function. So we're using a Lactoplanctobacillus plantarum RSB11, an L. rhamnosus RSB13, and L. acidophilus RSB12. These are live probiotic strains. And then we combine our probiotics with turmeric, holy basil, Vasica. These are herbal extracts that have been studied for respiratory benefits for a long time and can absolutely improve the bioactivity and efficacy of these strains. And so, kind of walking through that sort of pharmaceutical level rigor, we have multiple studies published and tested for efficacy in various live models. And so, when we looked at just the strains, we did various testing on individual strains as well as on the blend. And interestingly enough, we found that the blend of our strains actually outperformed the individual strains. And this is important because one thing the microbiome research has really looked at is you can have individual probiotics that are individually beneficial, but when they are combined, that they actually compete for that same ecological space and they can wipe out their individual benefits. And so this is important when we think about some of the probiotics that are like, and myths out there that was like, put as many things in a capsule as you can. We want to see that testing. We want to see that research because we want to see that there's complementary function versus individual strain and potential competition. And so we saw that the individual strains actually improved that MMP9, that biomarker of inflammation, better and absolutely outperformed those individual strains. And so we can see that here. We then did the same type of modeling on our herbal blend, so Vasica, holy basil, and turmeric, and we saw that the herbal blend also reduced those MMP9 levels. And then, of course, we looked at the final product, and I'll show you some other studies in a moment there. One of the things we looked at when we combined the product was looking at the impact of resb on LPS and lung architecture, and we saw that it improved inflammatory stress response. LPS obviously being highly inflammatory, and especially when it comes to respiratory health. This is part of why we see, respiratory distress in sepsis. And so then we found that also in this study that resb, the blend of the strains with those herbal components, decreased highly sensitive CRPD levels in mouse lung tissue when exposed to those LPSs, showing that decreased inflammation to the lungs. This was a human clinical trial that we did. This was out of the University of Cork, where we had 11 subjects with asthma. They took, this was an open label pilot study. They took resb twice daily for 4 weeks. And one of the things that we measured is what's known as FEV. FEV measures the air that you can exhale from your lungs, and this is a lung function test. And so we found that just in the matter of 4 weeks, that resb significantly increased FEV levels in asthmatics. So we know that a higher than average FEV level indicates stronger lung function, and so resb helped to increase lung function. And we know that people who smoked in this study that had chronic lung disease started to see improvement as well. We saw increased short chain fatty acid levels in asthmatics. So again, part of that mechanism of action is that we're increasing short chain fatty acids. Short chain fatty acids are anti-inflammatory metabolites. And so they can travel through the bloodstream, through the lymphatic system to decrease inflammation. We also saw quality of life improvements. So 36% noted an improvement in overall health. We saw less frequent coughing, fewer instances of shortness of breath, as well as fewer breathing-related sleep disturbances, which is really powerful because people who struggle from chronic lung conditions, smoke, have asthma, they saw improvement. And so if we can improve any aspect of quality of life through the lens of the microbiome, it's really exciting and really promising. The subjects who took resb in the study, 100% of the subjects who smoked would recommend resb. 90% of asthmatic patients would recommend resb as well, and more than 80% of healthy participants. So someone who's healthy, who's not complaining of lung respiratory conditions, also saw improvements to gut health and were also highly recommend resb. This was a 12-week RCT that we ran with resb in adults with COPD. We saw sputum biomarkers, so CRP in the sputum. So again, inflammatory biomarkers in sputum MMP9. So again, that enzyme that we know is related to tissue breakdown, improve with resb. And then one of the things we also wanted to look at was survivability. And so we did see through PCR testing that the lactobacilli showed increased levels in those who were taking resb. So that doesn't just indicate strain survival, but actual modulation of the microbiome. And so when we look at the mechanism of action behind this blend of resb, the blend of these live respiratory specific strains and these herbal components, the herbs are downregulating inflammation, they're quenching free radicals, they're promoting bronchodilation and mucus clearance, and these probiotic organisms are normalizing the gut microbiome because people who have asthma, people who have COPD have dysbiosis. And we're seeing the increase in short chain fatty acids, which we know are anti-inflammatory and are deficient in people who suffer from chronic respiratory conditions. So this is promoting immune and inflammatory modulation, truly targeting the lungs. So moving on to a precision prebiotic, and we think about the gut energy axis. This is a prebiotic resistant starch, a resistant potato starch combined with pure beetroot and methylated B12, focused on energy and metabolism and digestive health. So the resistant potato starch is unique in that it's a dual action resistant starch. Many of us are not consuming enough resistant starches in the diet. I know for myself, I'm not eating a ton of green bananas or cooled rice. And resistant starch has been in the human diet for over 10,000 years. And what's unique about this resistant potato starch is it's clinically meaningful and proven at a lower dose. So you don't need such significant doses, which is why it is digestively friendly. It's FODMAP friendly. One of the difficulties with prebiotics, these fructooligosaccharides, xylo-oligosaccharides, is that in people who suffer from digestive distress, things like SIBO and IBS, these can really drive a lot more digestive symptoms from bloating to gas. And so this is a prebiotic that can get added on right away in a microbiome support program because it's not going to increase those GI conditions. So it acts like a soluble and insoluble fiber. So it arrives in the large intestine intact, but it's completely fermentable by our bacteria. And studies that, when we look at just the individual studies on the resistant potato starch, it's supporting Akkermansia production, which we know helps with GLP-1 signaling and gut barrier integrity. The resistant starch alone increased GLP-1 levels. And then we also saw significant increase in bifidobacterium. And so again, precision prebiotic, meaning it's feeding those beneficial microbes. It's increasing keystone strains like Akkermansia, bifidobacteria that we know are essential for a healthy gut microbiome. And that's really important because most of the time when we see these types of bacteria that are undetectable, say on stool tests, they're there. They're on life support. They're just not getting the food to bring them back to make sure that they are not just surviving, but thriving. And so we have to feed them their precise nutrients. And this is a resistant starch that Akkermansia bifidobacterium prefer. Now, beyond the gut, when we look at what we've added in, beetroot extract, which is rich in nitrates, betalains, polyphenols that not only support nitric oxide production for better circulation, for heart health. We know that nitric oxide production is extremely important even for women who are in menopause, post-menopause, because of that estrogen decline, or those that have even MTHFR naturally produce less nitric oxide. So beetroot enhances gut motility. It's a great pre-workout, supports mitochondrial health, but it also modulates the microbiome. There's been studies looking at even after just 2 weeks of taking it, we see increased beneficial bacteria. And then we added in methylated B12 for that cellular energy to give that boost that we are often craving without needing caffeine. And so when we looked at, again, that sort of preclinical R&D development, we looked at the blend of the resistant starch in conjunction with the beetroot. And you can see different assays here that it was actually the blend of everything that produced the greatest benefits, that not only modulated the microbiome in producing, increasing the abundance of beneficial activity, but increasing that nitric oxide production as well. And so again, it was the blend of everything that produced the most significant effects. And so a lot of people will ask me, well, when you look at the dose of beetroot or this or that, how do we know it's comparable to other ones? That's why we're doing this preclinical assays, that we're finding the right dose with the right blend of these biotics to produce that optimal result where we don't necessarily need to give more. And we're seeing the benefits in increasing microbial diversity, increasing nitric oxide. And then because we know short chain fatty acids play such an integral role in metabolic health, we wanted to do a couple more assays in looking at GLP-1, and we saw a significant increase in natural or endogenous GLP-1 production, which again is heavily influenced by butyrate production. So that was really cool to see that this sort of metabolic brain axis, or what we call the gut energy axis. And then finally, this kind of led us to develop something further to improve metabolic health, because we know 88% of Americans are metabolically unhealthy, especially given this metabolic climate we're in the GLP-1 world that we're living in. We created a GLP-1 postbiotic, which uses a heat inactivated L. plantarum strain. So again, it's purposefully sort of killed to retain very targeted benefits. And one of the key benefits of this postbiotic is it targets GLP-1 production. And then we combined it with vitamin D, methylated B12, white mulberry, and fenugreek, which have really important appetite and insulin sensitivity benefits, and as well as chromium picolinate, which we know is important for metabolic health. And so taking us kind of through that sort of preclinical assay, we looked at the postbiotic first. So we saw that the postbiotic increased GLP-1 production. We also saw that the postbiotic reduced MMP9 in human gut cell models. So we saw the improvement to the metabolic space, but we also saw modulation in the microbiome in improving that tissue breakdown and degradation. We took the same assays to look at our herbal blend in white mulberry and fenugreek, and we saw that the herbal blend also increased GLP-1 production and also improved glucose consumption, so how well our cells take in glucose or utilize glucose. And then again from there, we did the combined product, and we saw that that ResM, the postbiotic combined with the vitamins and the herbs, also increased GLP-1 and glucose consumption. So we saw a 150% increase in glucose consumption, which again enhances the ability of our cells to absorb and metabolize glucose efficiently. We saw more than 300% increase in natural GLP-1 production. And right now, we currently have our RCT underway. Those results actually should be completed hopefully by Q3. So this is a first of its kind. There's no other study out there that's using a microbiome product in looking at metabolic changes. So really exciting, and we can't wait to see those results, and hopefully we'll be able to share those by the end of the year. But all of this really to highlight that microbiome care and microbiome solutions truly need to be targeted in precision, and that's how they fit into other interventions. And that's really why I'm excited at Resbiotic. We've recently just launched our exclusive healthcare provider program. We're offering providers like yourselves something I'm really excited about as a provider that's worked in the microbiome space. Microbiome modulation, we know, takes time. I've had a lot of patients come to me and they're like, after a month of taking a probiotic or a supplement, they're like, I don't feel any different. I don't see any changes. We know that meaningful change can take time. So I'm happy to offer a 60-day product line, something that, I'm really excited about, because we want patients to walk out with something that is more clinically meaningful. So they're taking something for a longer period of time initially so that we can start to see more meaningful changes. So something more patient adherent as well, since microbiome modulation does take time. We have exclusive resources, patient handouts, one-on-one clinical support as well. And so when it comes to choosing the right precision microbiome solutions, a lot of people say to me, well, who's ResB lung support probiotic for? We joke in our company as anyone who breathes, but this is really for someone who's struggling with any kind of acute or chronic lung dysfunction. We're about to enter into back to school and fall and cold and flu season. And for many of us, that means more respiratory distress. So this is something that we can take proactively. Asthma patients, COPD, allergy, anyone who's suffering from long COVID, chronic cough, but even athletes who are needing to optimize respiratory function. I live in Colorado. We've got lots of wildfires, and I get air quality notifications every single day. So something that I'm thinking about, especially because we've seen more studies come out now looking at the quality of air and how that impacts our lung function and our gut through the gut-lung axis. Now, Res-M, GLP-1 postbiotic, anyone who's wanting to optimize their metabolic health, this can be used in conjunction with other interventions. It can be used as a companion product for when people are taking GLP-1 agonists to support side effects, as people are going through dose adjustments. But we want to start to support the gut microbiome. We know that that increases effectiveness and long-term sustainable results even for those who are transitioning off or cycling through their GLP-1 agonists. So a lot of opportunity there. And this can absolutely be combined with other metabolic modalities. And then finally, our ResG Prebeat Energy prebiotic. This is to improve the gastrointestinal environment, to promote diversity, which we know is important when it comes to a healthy gut microbiome, supporting that short chain fatty acid production, enhancing performance, nitric oxide production. I love using it as a pre-workout. I put it in my morning drink with my other pre-workouts, my creatine, my electrolytes. But also anyone who's really wanting that energy boost in the middle of the day without wanting more caffeine. And so finally, in summary, right, when it comes to the microbiome, this gut-X axis, right, that bidirectional communication that exists between the microbiome and these key organ systems, right? Our lungs, our digestive tract, our metabolic pathways. When we have dysbiosis, when we have impaired gut barrier function, right? These are foundational triggers of systemic inflammation, disrupting immune tolerance and regulation, contributing to obviously chronic diseases across the system. And so it's important that we look at these communication pathways, microbial metabolites that truly act as signaling molecules. If we can address these pathways in ways that are requiring, obviously clinical precision, but truly leveraging these validated strains, these targeted compounds, this really increases clinical meaningfulness across the systems. And so we're focused at Resbiotic and pioneering these microbiome-based therapeutics using these drug development level standards, which again, trying to change that narrative and what quality supplements should look like, but also microbiome supplements, in that we are moving beyond just saying, oh, these strains or these bugs are good for us. We have the ability to truly understand their targeted functions and really giving provider-ready protocols that work through this lens of the gut-X axis. So with that, thank you so much. We're truly excited to be a sponsor here. If you have any questions for us, you can reach out to us at provider@resbiotic.com, and we'll be sure to leave our information there. Thank you so much.